Hey everyone, I'm Dr. Wyrick, and I'm going to share with you an interesting article that we came across and something we've actually started doing in our own clinic in regards to liver function and shockwave therapy. Now, shockwave therapy, if you look at it in the studies, if you're going to Google it, then you need to Google this word extracorporeal shockwave therapy, as you see right across the top of the study here. I'm going to put the link to this study in the description of this video so you can go ahead and find it. But there's been tons of study behind this. So for the patients that watch this video, this is shockwave therapy. Shockwave therapy is a non-invasive procedure that we use that uses a very, what's the word I'm looking for? It's more intense than ultrasound, but it's not such an intense sound wave that like lithotripsy. So here's the way I explain it. You have ultrasound that most people are familiar with. They use a very low intensity sound wave that penetrates the tissue and then bounces back, and they can show you a picture of tissue of a baby that's inside, or they can turn it up a little bit and actually use it to help break down scar tissue. That's on this side of the spectrum. Over here on this side of the spectrum, you have what they can use is called lithotripsy, where they break down kidney stones. So we can literally have the spectrum of sound waves that are available to us for therapies that can take pictures of babies or break rocks. Well, right in the middle of that is this thing called shockwave therapy, which is a low intensity sound wave, but it's much more intense than ultrasound, but it's not as intense as lithotripsy. And basically what it does is when you use the proper procedures, it causes microtrauma in the tissue and creates a condition in your body where your body overreacts, thinking it's more injured than it actually is. And we've seen everything from arthritis to wound healing and kind of everything in between actually get better with shockwave. And this one, when we found this, we actually have tried this on a few people and seen very, very good results. But this is low energy shockwave therapy for a model of liver cirrhosis to ameliorate or get rid of liver fibrosis and improve liver function, which is pretty cool. So if you go down here and actually read into the study, shockwave therapy has been studied as a new treatment. I point to my screen like you guys can see me pointing to it. Has been a new treatment for angina pectoris, which is chest pain, and several ischemic diseases because of its effective angiogenesis and inhibition of fibrosis of the heart. So what they're saying there is that shockwave has been studied and has been known to grow new blood vessels and has been shown to actually help with fibrosis of the heart. The effects of LESW on fibrosis in liver has not been studied till this particular study, and the aim of this study was to verify the amelioration of liver fibrosis by shockwave and elucidate in mechanisms in a rat model. So they took rats and they basically induced liver fibrosis in these rats with drugs, and then they took the rats and they went under and they did shockwave therapy with 7 of these rats. And what they found was right here, quantitative analysis showed that the area of fibrosis in the shockwave group was significantly reduced with the control group. So their liver fibrosis went down. Okay. In the shockwave group, the mRNA expressions of transforming growth factor was significantly suppressed. So transforming growth factor is what's going to cause that fibrosis to grow. And then vascular endothelial growth factor was significantly increased, meaning growth factors that help your body grow new blood vessels, they were increased in the control group as well. Serum albumin was significantly higher in the shockwave group than in the control group. Aspartate aminotransferase alanine aminotransferase ratio decreased with the control group. So overall, basically what happened is the liver with the control group now has the capacity to grow new blood vessels, improve blood flow, decrease actually fatty liver, and there's been some other studies that have come out on that, and the overall liver function has improved with these rats with shockwave therapy. So if you scroll down through, you can actually see some histological slides of the improved liver function, which is pretty cool, and then they graph everything out for you here. I'm going to scroll all the way down to the conclusion because it's awesome. The study investigated the effect of LESW on the liver in a rat model of drug-induced liver cirrhosis. The novel finding of the study was that LESW therapy improved hepatic fibrosis, hepatic function, and hepatic angiogenesis, accompanied by downregulation of TGF-beta 1 and upregulation of angiogenic factors beta bFGF and VEGF-B. The animal study suggests that LESW has the potential to be a safe and non-invasive approach for treatment of liver cirrhosis in the future. So there's the study. So when I do meet with our patients and we talk about, one of the many things we talk about is weight loss. We actually show them this study because if you can improve liver function, you're going to improve blood pressure, you're going to improve metabolism and improve overall health of the patient. So with the limited studies that we've done, we've been following the procedures used in this study, and we're actually seeing this in a human model, which I think is pretty awesome. So there's the study. I wanted to share it with you again. The link is in the description of the video. You can go check this out for yourself. So that's what I wanted to share today. Thanks a lot. See you next time.